Prepping. Great. So, good evening, everyone, and welcome to Medical Mondays with Dr. O. Tonight, we have one of our daughters, Dr. Udim Isang, a doctor of physical therapy who practices physical therapy in a different fashion, um, incorporating natural and more realistic ways, I would say, of practicing physical therapy to make it a healing tool that it is for people who engage her. So she's going to educate us tonight and empower us in the area of physical therapy and more. I must say that on this forum, I just want to remind us that we're not establishing patient physician or physician patient care. It's an educative forum, a forum for us to learn, to prevent disease entities, and to better our health. Without much ado, I'm going to yield to Dr. Udim. The floor is yours, and welcome.
Thank you so much. Thank you for the introduction. Like Dr. O said, my name is Dr. Udim Isang, and I'm a physical therapist, and I will be presenting today on Indigenous informed physical therapy and what that means to me and how we've come to have this specialty. So before I want to begin, I want to give a special shout out to Dr. O and this forum. I am a bit nervous, so I have a practice. This is probably one of the first times and probably one of the only spaces I feel comfortable and safe to open up with prayer, if that's okay. So I'm going to pray. You don't have to pray if you don't want to, but I'm going to. So Heavenly Father, Abasi Sasongo, thank you for today. Thank you for Dr. O and her heart, and just everything that she is doing. I have been sitting with just how instrumental Dr. O has been on my healing journey. And I am grateful and nervous to be in a room full of wonderful, wonderful physicians and doctors from all over the world, a lot of them being where I'm from, Nigeria. And it is an honor. It is an honor and a privilege. And I pray that you will help to calm my nerves, and just to move through me, and explain why it is I love physical therapy and what I do, and let that come across in a way that makes sense. In your precious name we pray. Amen.
Amen.
All right. So, who is Dr. Udom? So, I'm going to briefly go talk a little bit about who I am. I have my doctor of physical therapy from Howard University. I've been a physical therapist for 10 plus years now. I received my second doctorate in education, and I specialize in executive leadership and teaching and learning. Last year, actually. So I'm a doctor in physical therapy and a doctor in education. And I initially wanted to do that because I wanted to learn how to teach differently brained people like myself, people who may identify with, I call it neurodivergences, neurodistinctiveness, ways that people you need to learn differently. Like when Dr. O asked me, where did these captions come from? That's because my brain processes things differently. So sometimes it's helpful to see the words. I watch TV with captions on, and I request captions whenever I go to presentations and conferences because I need to see things. So people who need little accommodations to be able to understand and comprehend things. Very, very intelligent, obviously, because otherwise I wouldn't have two doctors. Just my brain is different than yours. So that's what I decided to go back to school for. And then Physical Therapy Association made it a requirement to be able to teach at university level to have not only a clinical doctorate, but also a terminal degree. So more school, but I finished. And along the way, I continued to learn more about my father's side of the family. And I was doing a lot of spiritual deconstruction, decolonization, just because I experienced not only racism throughout just my tenure as a physical therapist, but just in life. But anyway, so I just dived in and I learned more about the Anang people. And of course, my mom is Ibibio and my dad is from is Anang. And so I just spent 2 years continue up till now just learning more about our like cultural practices and just where my gifts came from, because I was like, I know my brain is different, but I know I'm not the only one whose brain is different. And so I had to go back to the root cause, which is my parents. So that's where I just decided to learn more about not only my Indigenous culture, but also cultures in all around the world. So I practice brain spotting, integrative manual therapy. I do Tai Chi, Qigong, and I incorporate that into my practice as a physical therapist to a way to really embody and bring together mind, body, and spirit. Okay. Founder. I am founder of the Fatima Institute. So that is the nonprofit I founded last year as well. And that is to provide holistic education, healing justice, and cultural reclamation. Because I don't know about anyone else in this room, but I had to fight to have my mom teach me Ibibio, and it didn't go out very well. But I'm teaching myself now Ibibio, Hausa, Yoruba, and I'm still reteaching Spanish. It took 6 years of Spanish, but it hasn't taken yet because I haven't moved there yet. But I will. I will be fluent. I'm also the owner of Sunny Therapeutics, which is my wellness practice where I blend manual therapy and movement and ancestral healing together. So not only my, modern American physical therapy, but also blending together what I ancestrally was gifted to me by my mom, by my dad, by all the other healers and practitioners that I've learned from in the last 10 years. Yes, I'm also an author of Liberation Through Practice, Voices of Black and Indigenous Healers, and that is my dissertation turned textbook slash memoir slash poetry book slash devotional. It is everything, and I tried to capture just all of who I am in one book. It was a roller coaster to get there, but I will be publishing and picking that up in Nigeria this year. So stay tuned if you're interested. I'm also a speaker, and I focus on centering inclusive and trauma-informed care. So I'm a survivor of many things, but also being differently brained. I've experienced a lot of difficulties in my career, and so I speak a lot about that, and I educate people about how to meet people who are differently brained, just different in general, so that we can truly heal the world together. That is my main focus. But I'm not just a therapist. I'm also a storyteller. I'm also a dancer from young age, in the Kwai Association. When I come be dance, I've been doing that since I could walk. And I've been dancing all of my life and still dance and teach dance now. I'm also a spiritual coach, and I'm an advocate for liberation through practice and just a better world. I don't just treat pain. I help people remember who they are, just like I've been blessed to remember who I am over the last few years specifically. And like I said, one of the people that have been so instrumental to that is Dr. O. So anyways, I'll stop talking about you, Dr. O. You're wonderful. So next we will talk about the history of physical therapy. So I know there was another physical therapist that came on here. So this might be a refresher for some, maybe new to others, but physical therapy, modern day, as we know it in the US of A, was born during World War I to rehabilitate the soldiers. And it was really on the spot treatment, like this is all we have, and it was born from nothing really, until now. Flash forward today when we have all of this technology and this equipment, and we've been able to integrate that into the field. But it was really about quick thinking and using your intuition on like, okay, this person comes into your office, and maybe they've gone to see other practitioners and doctors and they haven't been able to figure it out. Physical therapists are the people who can feel. I knew I was different when I was younger because I've just been a very sensitive child, and I can feel things energetically. And I stumbled into physical therapy. Me and my mom have different stories, but that's for another presentation. And over the years, I've come to know that physical therapy allows me to actually feel the patient. There's a lot of fields that are very engineering, like where you have to have a very specific brain, like an engineer or architect, to be able to, need things like precise. And physical therapy is not that. And it's perfect for people who are on the go, on the fly, and intuitively can feel things with me specifically with my hands. Um, and so that is why I joined physical therapy. And that's, I'm assuming, why the people who are rehabbing soldiers, literally, on the ground zero, able to help and treat and put together a leg and, all of these things, and then get them back walking so they can go back and do what they had to do. Like that is beautiful. And it expanded into so many different specialties. So we have orthopedics, we have neurology, we have pediatrics, we have women's health, we have oncology, so many things. And the one that we know in the US, Western, is insurance driven, Western focused, and very, very standardized. And I'm not going to put the definition of them that yet, but actually, this will be the first quiz question. Can anybody tell me in their words, their definition, what physical therapy is? I'll just have one volunteer and then I'll keep going. And you can just come off mic and say, any takers? Not yet? Oh, I see Ben Wu. I think they're trying to speak. Can you hear me?
Therapy.
Okay, there we go. Hi, Oyen.
Hi. And I'm just gonna say it. I know what it means really, but if you want to say literally, it's a therapy that is physical and not mental.
Wonderful. I thank you for your definition. All right. Okay, I'll keep going. So why I chose my own lane. All those specialties I named are credentialed by the American Physical Therapy Association. They have, all of these regulations and rules that they govern. And none of them felt like me. Um, After, I think, 4 years, I chose the hardest, I feel like, specialty to jump right into, which is inpatient rehab, where you have the patient 3 hours a day and you get your most chronic patients, get, fresh stroke, people who have had strokes. You get stroke, spinal cord injury. You get people who get, run over and they're on a bicycle. Or I had one patient and, they were walking and their dog got scared or was chasing a squirrel, and then the leash went, and then there he went down onto the ground at the park, things like that. So I've seen all of these different conditions and experiences all in this setting, and it was amazing. But I was like, okay, I still am not really able to use my gifts. And that is when I started to move around and try different settings. I left inpatient rehab. I worked in outpatient rehab. I worked in a jail. We did outpatient. I did skilled nursing, acute care, um, pediatrics, school therapy. My outdoor therapy is my jam, but we'll talk about that later. But that's how Indigenous informed physical therapy came about. It was just all of this on this slide. Bureaucracy and rigid protocols and lack of creativity and cultural invisibility and lack of space for grief and spirit ancestral memory. Maybe this was just healthcare, the hospital system in general, but when I had patients, that came in with Lou Gehrig's disease or multiple sclerosis, like lifelong, really terrible, terrible diseases that people have to live with, I was just seeing the discrepancies or where, we might have dropped the ball, and I wanted to fix everything. And I was like, why is this not working? Why is this not working? So I was just like, there's got to be a way, and there has to be something. And I couldn't find anything. So that's part of the reason why I started my own practice. Yes, that's what I was talking about. So I worked everywhere. Literally every setting that you can imagine, I have worked in physical therapy. Very grateful for that, because in school, I already knew, I was like, I'm going to be a generalist. I'm literally going to be amazing at everything. I don't know if that was me being a Sagittarius or me being Nigerian, but I was like, I'm learning everything and I'm going to be great in everything. So fast forward to today, I do travel physical therapy and I do pop-ups and vending events at farms. I do a lot of outdoor therapy because I love outdoors, and just being outside in nature is very, very healing to the nervous system. And through that, led to the creation of Indigenous informed physical therapy. And this, in part was me exploring, like, this is what it means to be Nigerian. This is what it means to, live, in Uyo.
That they've been making. And when I heard this, I thought all the way back to November of 2017. Because I remember a Rush Limbaugh said.
Oh, great. Thank you.
Sorry about that.
That's okay. That's okay. I was saying, I went on a medical mission. My mom is going through, I'm mad at myself for not remembering the association, but we went back to Ibesipo Asutan for a week, and it was nonstop surgeries and blood pressure checks and wellness visits and eye exams. And I was like, this is amazing. And I was like, well, why does this only happen once out of the week? I was like, where are people getting this type of care on a regular? So I was just noticing and observing and researching how care, is in some more rural village regions, and how it is in the city. And I was like, I want to fix that discrepancy. I want, to be able to bring those two things together, or be with people who are doing those things. So in wanting to return to, I have no equipment. Someone has dropped me a God said, I got to go here for 3 months and take care of these people. And I'm like, okay, bet. But how do I do that with only my hands? And I've been searching and searching, learning and learning, and finding how Indigenous people, how we did it, thousands and thousands of years ago from cultures all over the world. So that is Indigenous informed physical therapy. It is a holistic approach to healing that integrates clinical foundations of Western physical therapy with cultural and spiritual and ancestral knowledge of Indigenous peoples. It recognizes that the body holds story, memory, spirit, not just muscles and joints. And I will talk about the science later, but it is a science to it. And if you think this might sound woo-woo, it is very, very, very technical and science-based. Healing is not just physical, it's very relational and emotional and energetic. And if you don't know what the power of prayer is, then this might not gel with you, because it's an energy. When you pray for someone, you get down on your knees and you say, I pray that they, succeed in life and get a job. Like, you're well wishing that, and your body and your nervous system feels that. And sometimes when we have too much negative emotion or negative wishes, or everything's going bad in our life, our body also holds that memory, and then that causes the diseases and the disability. And I say, specifically, I'm talking about my experience, because I am Nigerian, I have been able to hold a lot. Being a queer immigrant neurodivergent practitioner in the United States of America. I literally came out on Dr. O's show, and I never in my life thought that I would, even tell my mother all of who I am. And so I feel truly blessed to be here and to be in a space where I do feel comfortable to share with a room full of Nigerians, even in the state the way the world is now, that I am here for a reason, and I am here to heal, and I'm here to do that in the way that God told me to do. With my gifts, with my voice, with my knowledge. So Western science is included, Indigenous wisdom from Eastern Asia, and EBBO, together I use that, and I support the healing that is trauma care, culturally rooted, spiritually relevant, as well as liberatory and anti-colonial. Because a lot of these things that I learned in school, I realized I've already known. I realized that, my mom taught me a long time ago, or my uncle told me a long time ago, and then it was repackaged into a way where, it was whitewashed. And that's part of the journey to reclaiming the God-given gifts that I was born with, and that we are born with as Africans, and as, people of color from other different countries, because there are a lot of us in this room. And that is something that I'm passionate about. So thank y'all for listening. Next, I think I really spoke about the combination and the importance of that, because it's not one foundation over another. It's really combining all that we know and all of the research and staying evidence-based. And so there's biomechanics and Indigenous informed rehab, there's neuro rehab, there's pain science, there's also using our hands. As a physical therapist, sometimes I remember seeing a patient for an hour and maybe only being able to truly like manipulate their body and get into reposition and do what it's supposed to do, maybe like 10 minutes out of the 60 minutes. And I was like, this don't make no sense. I am a physical therapist, but I feel like I'm on the computer all of the time. And I was like, that doesn't make sense. So I did the Indigenous thing and I prayed and I researched and I was like, okay, I have two sides of the brain. We have our left brain, which is the doer, right? That's, most right-handed people. And then you have the left brain, and that's, well, did I say that right? Right brain. So that's usually left-handed people. That's your creativity. That's your intuition. I knew this before I knew that I knew it, or oh, I did that before. So that's just like, okay, someone walks into your treatment room. I can just look at people now after 10 years and, see the misalignment in their posture. And I know my hands just start moving and I'm just like, oh, okay. So that's the Indigenous wisdom. And then at the intersection where I'm truly able to treat the structure as well as what's surrounding it. Because if, for example, I don't know if you can see me, if I'm slouched like this all day because I'm on the computer, I'm personally sad. I don't know if the person who is on the computer like this for 8 hours a day is sad, but their spine is sad. Their cervical spine, the thoracic spine is screaming for help. And a lot of times we forget to just, stand up, take a break and stretch and do all of these things. Sometimes I would sit there and do notes and I would forget to go pee. I would literally I have to go beat traffic, bah, 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 bah. And I was burnt out. I was burnt out and I almost left physical therapy. I almost left the thing that I fell in love with and that I truly felt like I was gifted to be in, or, supposed to be in the profession to change. And so by combining both Indigenous and Western medicine and working at the intersection, I not only created the specialty, which is not really a specialty, it's just the way Dr. Udim does things, but I also fell back in love with physical therapy. And I think it's a profession that is often slept on. And another reason why so many of us, about 30% physical therapists, left the profession between the years of 2020 and 2022. A couple of my classmates as well. So sad. And I pray things change, but that's the reality. And we need each other. So I'm once again so grateful for this space, because us learning from each other is a beautiful thing. And I think we are changing the world, everyone on this Zoom room. All right, so why this work matters. Because Western physical therapy ignores grief and ancestral memory, which is also very, very important to recognize that lives in our body. Indigenous informed care, it heals the body, it heals the mind, it heals the spirit. I don't know if anyone has been in physical therapy. If you find a good physical therapist, once again, I'm biased because I'm amazing, but I'm going to spend maybe 10, 20 minutes every session talking to you and seeing how you're doing. Seeing, if you've kept up with your routines, if you've continued to do the things that you said that you're going to do to reach your goals. Like, I love checking in. And I think that is so important. And that's one of the things physical therapists do, is that we are your accountability coach. And a lot of people don't have that in their life, or maybe they have people in their life that are not ready to change. And so we might be the only people that they can talk to every week and say, you know what? This knee is not where it needs to be, so that I can, run a marathon. And then we talk about why is it, and then what barriers are getting in the way for you to be able to do those things. And we come up with a plan together. So that's why I love it. That's why I feel like it works, is because we're truly connecting, what's happening in your mind, spiritually, what's happening in your environment, because it all matters. And healing is cultural and relational and embodied. And so the relationship that we have is also important. And, you know, what your cultural practices are important, and whether or not you can actually achieve your goals, or do you have realistic goals, and how can I help you? All of those things are talked about and discussed. And so integrating all of those things together is really, really important. And if that's not your physical therapist or your physical therapy experience in the past, I apologize wholeheartedly. You're welcome now that you've met me. I will share my contact information if anyone wants to reach out or just has questions in general. So thank you for listening. So far, I have a case study. Don't worry, it's not going to be long and boring. I'll have a case study, and then we're going to play a game. Okay, so we have a 34-year-old Black woman who is post-COVID, and she's grieving. And I'm trying to pinpoint when I wrote this, which specific person I was talking about, because I had so many, honestly. And you could have never told me that the pandemic was something that was going to happen in my lifetime. Not after Y2K, not after September 11th, not after, you know, DC Sniper. Like, you could have never told me all these things happened in my lifetime. Virginia State University shooting. Like, it's been a very heavy 35 years on this planet. And I never saw so many zombies walking corpse than I did during 2020 to 2024. And post-COVID was a lot of people that didn't know that they had post-COVID, a lot of people who kept working through it and just thought maybe, you know, they were depressed or they just hated though these are some of the symptoms. Like it's a certain posture and energy that person walks into the room who has post-COVID. Some of these people have never actually had that tested positive, but somehow got it. And then you have those who did have COVID and then just never fully recovered. And some of the symptoms that this specific person had was fatigue and breathlessness and brain fog. I don't know about you, but I had these symptoms before COVID, just going to work sometimes, you know? So imagine like that being magnified. Imagine that's your baseline and then it gets worse. And we did a lot of nervous system resetting, This person, they were wearing N95 inside and outside. They no longer could drive. They no longer could work. They needed assistance with cooking and cleaning, and their friends and family were supporting them as best as they could, delivering groceries. And them coming into the clinic was their main activity for the week. And that was sad to watch. So they were afraid to go outside. It was just a lot of fear that the pandemic instilled in them that they were not able to release, because, you know, antibiotics, whatever treatment they got at the hospital, it did not work. I think at this time we did not have the whatever series that they give you now when you test and you go to the hospital. I don't know what it's called. That wasn't there. Didn't have that. And I didn't go back into the hospital after that because it was a morgue. It was a morgue. So we did a lot of just grounding, you know, you are here, you are present, everything's going to be okay. You know, we had to find out what they enjoyed and loved in life because they holding on by a thread, truly. So we went outside. We had therapy outside. I recommended some teas. Right now I have ginger, I don't think you can't see it because I'll show it later, but ginger honey tea, chamomile, lavender, everything to help soothe the nervous system. We talked about nutrition and, you know, simple things that she could cook herself to eat when she had enough strength to do so. Walked outside. Humming was helpful to activate the lungs and the vocal cords because their voice was also, they had difficulty speaking. Oh, she also wore sunshades, so light, very, very sensitive to the light. her nervous system was very, 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 very depressed. And I think I saw them for about 6 months, virtual and in person. And over time, gradually, in addition to saying, oh, I made it out the house to go to therapy, it was like oh, I was able to go to my friend's house, or I was able to go to a Social Security office to apply for disability, or I was able to go grocery shopping. That was another, like, to be able. Grocery stores are very loud, bright, and overstimulating. That is a terrible place for a post-COVID person or someone concussion or brain injury. So every week she was doing more things. She improved her breathing. She had decreased pain because also everything hurt. So we did a lot of approximation, a lot of acupressure, and emotional grounding. Like, it's okay. You're going to be okay. Like, you can go outside, you can do this. And yeah, I was seeing a lot of those patients around that time. And these are some of the things that I used to treat them, in addition to, because exercising was a lot. That's on the end of the spectrum. The exercise was getting to me and then going back home. So it was a steady progression. And I think by the end of 6 months, she was doing yoga and she was walking, and that was great. And I think she actually went back to work. So very, 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 very happy to have been a part of her healing journey at that time. All right. Whew. Let's take a break. Let's stretch. It's quiz time. You guys ready? So I'm going to read the question, and then you can put your answer in the group chat. I know I didn't talk about half of these questions, and well, maybe I did, or you weren't paying attention. Either way, we're going to learn today. So if everyone could drop their A, B, D, C in the chat. When did physical therapy formally begin in the US? Ooh, hold on, I'm moving too fast. I'll give people a couple more. Trying to find what is this thing called? Notes, so I can see your responses. There you are, chat. Okay. World War One. Yeah, yep, there we go. World War One. Okay. We'll move on to the next one. Oh, I think you can see my answers, but that's okay. B is the answer to that one. 1918, World War One. Yes, good job, Issa. Amazing.
That's actually Hammond from London.
Hammond put yep, World War One, and then Issa put B.
From London. He's in London right
correct.
now, and it's about maybe almost 1 a.m. in London.
Oh, thank you for joining us.
Thanks, Hammond.
Okay, good job. All right, number 2, next question. Which of these is not a traditional physical therapy specialty? You can drop it in the chat. See A, D, D. I think I'm giving y'all the answer.
No, there are 2 Ds in the chat box. No, 3 Ds in the chat box.
3 Ds, okay.
A B, an A, and 3 Ds in the chat box.
You guys are good. Yep. So which of these is not a traditional specialty? It is D, cultural somatics. Yep, orthopedics is a specialty. That's the hip replacements, knee replacements, shoulder replacements. And then cardiopulmonary, that's your strokes and your pacemaker placements. That's your heart failure. That's women's health. Women's health is also a specialty. So it's called women's health. I'm working for, we're advocating for them to change it. But it's really just sexual health, sexual organ health. So work a lot on like incontinence or post-surgery or after people have babies, after vasectomies, prostate cancer. Like there's a lot of strengthening that is needed in those regions, and we do that. the more you know. Cultural somatics, however, is not official specialty, even though it should, but it's really, yeah, it's not. I won't go into it. But it's not recognized yet. So that's part of the work, is recognizing other traditions that came before all of these other foolish ones. Okay, next. Number 3, what is the average time a physical therapist gets with a hospital patient? A, 30 to 60 minutes. B, 15 to 30 minutes. C, 60 to 90 minutes. Or D, as long as the patient needs. Okay, so I see a B, I see a B, I see another B, I see an A, I see an A. Wait for no, these are good. Do we have any more responses? We got B's and A's. Okay, and a C. So most sessions are limited by insurance. That's actually a trick question. Most sessions are limited by insurance, and it also depends on the specialty or setting that you're in. So whether or not you're in acute care, which is you're at home and you choke on a chicken bone, and your friend rushes you to the hospital. You're going to the hospital, they do their treatment, they fix the chicken bone, take it out. They say you should stay overnight. We're going to run some tests, make sure you're okay. They're like, the physical therapist is going to see you in the morning to make sure you are fit to go home. That is acute care. So in that setting, sometimes we'll see you from 15 minutes to 30 minutes, unless you're in the oncology floor or pediatrics. We could technically get more time. And acute rehab, like I said, sometimes we see patients for up to 3 hours. But on average, the answer is B, 15 to 30 minutes. So that is the answer to that question, B. So all the people that put B, yay. All right. Number 4, can physical therapists treat a patient without informed consent? A, yes, if the doctor orders it. B, yes, in emergencies. C, no consent, or no, consent is always required. Or D, only in home health settings. What is your answer? C.
We're in
C,
America.
C. Right. Exactly.
All the answers are C's.
If the doctor ordered 1A.
Oh, 1A, really? And then I think 1B.
And 1B.
Yeah.
All right. Yes, in America. C, consent is legally and ethically required. Correct. There's no explanation really. That's just what it is. All right, number 5. La, 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 la. Which tools are used in physical therapy? Foam roll oil. These don't have A, B, or C or D because you can select more than one. So we can put in the chat box if we can use only foam rollers, only manual therapy, only ultrasound machines, only prayer board, or all of them. So you put how many letters you want. There you go. Have fun. Okay, I see an A, B, and a C. I see 1 through 3. I see A, B, C's. A through D. A, B, C. A, B, C, D. All right, good answers. The answer to number 5 is D, or not, well, D is all of them. So the tools vary by clinic and specialty. And so if you come to see me, you will find all 4 in my clinic, and all other a range of modalities and equipment. So a prayer bowl for me specifically would be like my sound bowl, or my drum, I have drums and I use art therapy and music therapy, and I incorporate that into my treatment as well, because sometimes, not sometimes, a lot of time, that is, research has shown that that's helpful to move stuck energy, in addition to journaling and doing exercises and moving your body to rehab yourself. And this works a lot with when I'm working with patients with grief and other emotional, spiritual things. So all of the above are used in physical therapy.
What is that standard, the prayer bowl?
That is not standard. That so the physical therapists that use those are more the holistic practitioners who also do a lot of therapeutic yoga, a lot of therapeutic massage. It's not divided in half. I would say I can't actually give a number, but in my experience, I have met physical therapists who are more logical brained or like needs specific tests and measures and rules and things like that to follow. Those are those would be your more left-brained humans. And then you have your more right-brained humans. You're like, I'm going to use everything I can to treat and heal people. And that would be me. And your other left-brained people. So we try and use everything. All right. More questions. I think we have like 2, 3, 4 more. I'm lying to y'all. 5 more. Okay, almost done. Number 6. How many specialties are recognized by the American Physical Therapy Society? Let's see if anybody remembers. A is 5, B is 8, C is D, and C is 10, and D is 12. Okay, we got one C. I forgot about my T. Got one A. A D. A C. Oh, give me variety now. I like that. Another B. D. Just like I prayed before this presentation to give me strength, that's what we do. And I have 2 seconds in between patients. I pray.
Okay, so the commenter is Dr. Kukwola, and he's a physical therapist. He's actually he's an amazing physical therapist, and that was why I asked the question if prayer
Mhm.
is standard, because ideally I mean, we allopaths, we're gonna stick with the top three and not the prayer bowl. Just
Mhm.
because it is not standard. Um, you incorporate prayer bowl and it's excellent. And I'm thankful for my brother, brother Tai, who asked what is prayer bowl, and you were able to explain
Mhm.
that as drums and things that you incorporate, sort of prayers. There are people who pray with you, but it's not standard. It's not part of physical therapy. It's what is
Correct.
in. Yeah, because he's a physical therapist himself. That's why he made that comment. I just
And
wanted
I
to
appreciate
clear.
that. It's the no part that I took issue with, the no prayer bowls. And every once again, everybody's practice is different and everyone is different. Otherwise, this world would be very, very boring. But one of the things that people don't understand about physical therapists, right, is that we have our doctorates. And the doctorates, we learn the business side, and and with that, right out of school, we were able to open up our own practices. And with that benefit, you can see and treat the patient and that's what I did for myself. And so I'm grateful to have been able to enter a profession that allows me to do that. And I think, not even I think, but it's one of the things that the American Physical Therapy Association and others that I've been in discussion with. There are a lot of rules and regulations that don't make sense for the day and the times that we're living in. And part of my work has been to educate people on cultural competency. And if I don't recognize that my patient in front of me, who's from a whole nother country, needs these practices in order to be able to understand me, if I, half the time I'm interpreting or explaining, and that's part of what physical therapists do. And in my experience, learning and treating with all of these modalities has been able to to connect with my patient on a deeper level, on a faster level, so they can heal. And I'm not taking their money forever and ever, or insurance in that, because physical therapists get paid like $10 for per hour, basically, if you take insurance. If anybody knew. So thank you so much,
So,
Dr.
yeah,
Adelola.
no, Dr.
Adeola.
Popola,
Dr. Popola.
he's also in private practice, and
Mhm.
he, everybody practices differently, and that's
Exactly.
so.
Exactly. So I'm
Um,
not going to come and judge or shame your
yeah.
practice. And I appreciate the lack, you not doing so for me as well. Thank you. All right. Question number
Carmen,
7.
Carmen, when you want me to jump in, I'll jump in on that.
No,
Not right now.
Okay.
I,
You want to
yeah,
finish
Okay.
the
well,
question,
Later
and
on
then
tomorrow.
no,
Okay.
don't wait till tomorrow. I'm going to call you. You'll be the first person to comment when we get to Q&A. So how
You're
many more
welcome.
questions do you have?
I have 1, 2, 3, 4 more questions. And
Okay.
then we'll do audience takeaways and question and answer. Excuse me. All right, number 7. What's a major limitation of a physical therapist faces? A, time limits. B, cultural erasure. C, pressure to discharge. Or D, all of the above. All right, lots of D's. Whoops. Skip it to the next question. Lots of D's. Okay. So for question 7, which is what's a major limitation physical therapists face? It is a combination of research-based. Research says pressure to discharge, C. But I believe it is all the above. This one article specifically, I can send that if anyone's interested, but if you are not in private practice and you work for big hospital corporations or work for another private practice that is based on insurance, there is pressure as a clinician to fix the patient faster, not at the fault of the clinician, not at the fault of the owner of the practice, but insurance. Insurance has their time metrics. Insurance has how well they want you to fix this person and get them out of their face so they don't have to pay anymore. That's just, the confines of what it is. And so that pressure is felt not only in physical therapy, but across healthcare. And one of my pain points and things I'm advocating for in the field. So the answer for that question is technically C, but I love everyone that said D. All right, number 8. True or false? Movement is only therapeutic if it follows a structured plan. False. Thank you for that. Capital false. False. At this point, yes, false. That is, you are all correct. Everyone gets a star. Movement, if not ever, it's usually intuitive, like I said previously when I was talking about the World War I and how it came about when we as a physical therapist were rehabilitating soldiers in real time. It is very, very intuitive. It can be very, very on the fly. Even if I have created this whole plan of care, which we do, right? We have to create a plan of care and how all of these pieces together. Sometimes, patient either gets worse, sometimes patient gets better, sometimes they stay the same, because we're dealing with humans. We're not robots. We ourselves are humans, and things change. And I'm very, very glad to say, it doesn't follow a structured plan, because I would not still be able to work if it did. So that is the answer. False. All right. 2 more questions. Number 9, true or false? Most physical therapists are trained to treat grief. False. 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 Yep. False. You are not the father. Yep, that is correct. False. Most physical therapists are not trained to treat grief. We are trained to treat a lot of things. We are experts in human anatomy. They taught us all the business aside, with the shift of the degree from a bachelor's to a doctorate in physical therapy. But I personally did not learn about grief until the pandemic. So I talk about that a lot because it was very instrumental to my journey as a clinician, but I also decided that I wanted to educate myself on how to meet somebody where they are, and educate myself on the psychological component and how grief affects the body. So I took a course. It was one of my patients, and another clinician who recommended this course. She was seeing a lot of post-COVID patients, and it was a brain spotting course, brain spotting for Black and Indigenous healers, and that caused a lot of turning point in my care, my treatment of my patients, and I saw a lot of results faster because we were able to just move through things in a different and a better way, but without holding all of the grief from, is the world going to end? Which is what a lot of people were walking in with, in addition to, oh, I tripped over my cat, or I had a hip surgery, or, I fell down the steps and now I'm, all of these things. Anyways,
So,
number 10.
no, before you go to number 10, Dr. Kinde Elisha is big on mental health. And I can see
Mm-hmm.
how this hits home for her. She said, but you can respond therapeutically to a grieving
Mm-hmm.
patient, right? She's agreeing that, most are not trained to treat grief, but do they even respond therapeutically to grieving patients? Is the question she's asking.
Do they
So,
respond therapeutic?
so physical therapists
Mm-hmm.
respond therapeutically to grief
Mm-hmm.
when they see a grieving patient, or do they just bypass the grief and deal with that fall or what else is going on?
If you don't know what you're looking for, yes, that happens a lot. And like I said, we're not trained in physical therapy school per se on the mental health aspects. And one thing I learned is that I too have to be self-aware and myself receiving mental health, so that I can be empathetic. Uh, we grieve every day as humans, and I cannot see someone else's grief if I myself am not looking at my own grief. And when I started therapy for myself, all types of therapy, art therapy, music therapy, talk therapy, uh, I was like, I don't know, it was a whole new world opened up. A whole new world opened up, and I was just better able to connect with my patients. And so, no, a lot of physical therapists, they bypass that part. And I was noticing that. I was not, because I'm a very sensitive person, a very sensitive human. Like I said, I need captions, I need headphones and loud spaces, so I'm not overwhelmed. I have to keep my hands busy. Like, I know these things about myself with therapy. And a lot of people walk around unaware that, there are things that they can do to ground themselves, or that they can do to calm themselves in situations that they may be anxious about. And so, like I said, that is what I educate people on. Like there are multiple ways to, I don't like that phrase. What is that? Skin a cat? We're positive. I need a positive one. There are multiple ways to heal. And so I had to learn those ways for myself in order to prescribe that to others. So thank you for that question, Dr. Kalindi.
Oh, thank you.
And
Dr.
and last question, true or false, ancestral healing can be integrated into physical therapy? I think I've answered that question multiple times over. True or false? True, true, true. Amazing. Yes. Yes. You guys have made it through 10 rounds of physical therapy with me, or this presentation and the quiz. You all get, can I do this emoji? A heart. I'll give everyone a heart. Thank you for participating so much. Now it's time for audience takeaways.
Yeah, so
So
if you take down this slide, I will,
yeah,
then throw it out to the audience and they can guide
okay.
us into how to move this forward.
Yeah.
Excellent. Excellent presentation. I'll tell you, I learned all over again that physical therapy is not what I thought it was before I met Dr. Popola. That it's about, the orthopedic part. Somebody falls, they need hip, whatever, they had surgery, they need physical therapy to now get the movement going. It's a lot more than that. There's the pediatric, the heart, now the mental health physical therapy. That is fantastic. Dr. Elisha, I'm going to call on you as soon as I get Dr. Kukwala. I promised him, and I know he's going to say I'm going to bypass him. I'm not. I promise you that I'll call on you first, Dr. Kukwala. Go ahead, um, put up your fight, and then I'll call on Dr. Elisha.
My colleague will not fight with me, but certainly, Dr. Udim, thank you so very much. Your style of presentation is so unique, and some of those questions actually bored me. I'm not too sure I will pass your board if you were the one setting the questions for me. But I remember you clearly the first time I met you, and I'm so very happy you have a practice now. Thank God. I wish you the best. However, I won't let that go away. I put in the chat, I said that who pays for prayer as a form of therapy? Because the bottom line is that someone has to, there's no free lunch anywhere. Okay? But let's be very serious about it. Your personality, your human connection and interaction. Okay? We all pray so much when we are seeing patients. You pray that that patient do not throw an emboli when you are exercising him and going to cardiac events. You pray that the patient does not fall in your clinic, in your hospital, even in your parking lot, because that might actually let you lose not just money, but license. Okay, a lot of things can crop up. You pray that your patient should not experience Valsalva maneuver, okay, and you trigger a cardiovascular or cardiopulmonary issue. There are so many things. But when a patient comes to me and I say, let me offer you prayer, we say that is the code of ethics does not actually permit that. And cultural competence does not permit that. You're talking to an atheist like some people, and the first thing you say, what do you mean? Okay? And we wouldn't put that as part of our standards of practice. If the prayer bowls are there, sincerely speaking, I know it will work. As soon as they come in, they will see your rosary and they will respect it and appreciate it. But anything that is not going to be paid for, okay, based on your ICD-9 codes and CPS, you probably will not be able to make it part of practice. Anecdotal, that is things that are not already backed up or insurance will not understand, okay? Like some of the things I even do. Once you know it is safe and want to know informed opinion, okay, will make it relevant. Of course, that's why you're a trained professional, and I appreciate you using that, your extent of information and knowledge. But that one too, one has to be careful when you're using it. A patient can actually pull the rug under your feet on that. And if it's not in the established codes, not just that would they ask you for your rationale, you have to provide peer-reviewed articles, okay, and information that allows you to even think of using that. These are just some gray areas. I also have here, when you talk about the mental health, and one of the things exercise does is that it promotes the body in such a way that medications or drugs are metabolized better. Okay, it promotes it promotes the production of serotonin, the feel good hormone, and all the other things. And there's a whole lot of field in that area. So these are my first questions, responses, and I will join you in reacting and responding to some of our colleagues who are going to ask us more provocative things. Thank you.
Thank you.
I'm on your side.
Thank you.
You are.
Thank you, thank you, thank you. Again, we all practice differently. And in medicine, thank God today in the US, it is allowed. You practice based on your training. She went for training to do some more on mental health. And on that note, I'm going to yield to Dr. Kehinde Elisha. You have the floor. Welcome.
All right. Thank you so much for having me and for taking my question. So, yeah, that was an amazing topic. And sorry, I actually logged in late, but the little that I caught was actually pretty impressive. And I love the fact that you actually threw some quizzes at the end too. That was some thought-provoking quizzes. And the one that struck me was that one about you being a part of grief. And I'm glad that you cited COVID. COVID, I happened to be a nurse at the time, a bedside nurse in intensive care unit, was all over their faces, actually, you know what I mean? Suctioning patients. Okay. Thank God I never got COVID, but I was in the middle of it, period. And I bless God that I was able to do that. But we never did it alone, too, though, because patients were actually on big mansions that require physical therapists to, in fact, assist us to actually lift patients as well. They were lifting patients, they were turning patients. There are certain positions that we have to have patients for fluids to move in the lungs, and physical therapists and occupational therapists were all part of that. Now, my take when it comes to all the falses that I saw in the chat, I almost put true. I was like, no, my answer will not be different. I'm just gonna hold my answer until I was gonna put true, okay? Because this is it. I feel like in healthcare profession generally, we were taught therapeutic communication, no matter what course, what subject. There is something about therapeutic communication, and also there is also something about Kubler-Ross's death and dying theory. So my point is, we all learn this, so we don't have to learn it to a full scale to be touchy. For example, now I love your aspect of saying you took that initiative to actually get deeper in it because it was not heavily emphasized perhaps in your curriculum, I guess. But honestly, it doesn't even take any education to have that human connection. Maybe that's just, me being a healthcare and ICU patient in general. I just don't see me or even you doing physical therapy on a patient that is thinking about the death, the husband that just died, or the son that just died in a car crash or in a plane crash, and you'd be like, "Hey, sorry, I need to see the next patient." No, I wouldn't want you again as my physical therapist, and that is kind of what I'm trying to say right there. The false answer, I would take it because everybody said it, but I disagree. So hopefully, maybe we all together as healthcare provider, if it is not heavily emphasized in your curriculum, maybe there needs to be a change. Because that is one thing that is even killing patients the more, really. It is the fact that nobody's there to really talk to them. I understand you're not a therapist when it comes to psychotherapists. However, it takes a little bit of touch and a little moment, one or two words to actually get that patient going, and even for you to even maintain that therapeutic alliance, for them to even cooperate with you to do what you want them to do. It takes just a little bit of comment, not rushing them, and just listening to a few words that they have to say. It goes a long way for them. Thank you. That's all I have to add. And thanks for taking the initiative to actually step out and do what you have to do to deal with grieving. And COVID was a good example that you gave. I don't see any therapist walking away from a patient that just lost like 5 people in the family. It's just not realistic, even whether you were taught, whether you learn it or not. So that's where my yes came from. But if your curriculum is like that, I respect it, but I look forward to more changes in that if it's like that. If it's what I'm thinking, I don't know. It just doesn't sit well with me a little bit.
Yeah, it doesn't make sense, right? But I
Doesn't
work
make
with
any
these
sense.
therapists.
Doesn't make any sense. You're working with intensive care patients. I don't see you not being not having to deal with that. You will have to deal with that to be the best therapist.
Yeah, ICU is a very special setting, so bless you, because anyone who decides to work and can maintain every day coming into ICU, you are special humans
No, I did
because
my
you
best. I don't
need
know if I
that level
maintained
of
it. I was going crazy. But thank God
you
for
can
that.
do
Thank
it.
God. Yeah.
Yeah, thank you so much.
So, thank
And
you.
that is the truth. I see you special, and thank you so much for serving. Thank you
Thank
for
you.
all you have done. Thank you for all you're still doing. However, it is not just in ICU. Mental health is real today. There's so much going on in our communities, in our societies that, cause mental health issues. It doesn't matter what branch of medicine, what specialty of medicine, you will need to deal with mental health issues. And I pray that we are all empathetic because there's no way as a healthcare professional of any specialty that you can best meet the needs of your patients without paying attention to their mental health, without, giving an extra time, whether insurance pays for it or not, to listen if it's just listening, and even to refer them to counselors, to psychiatrists, if they need it. It's very important. And I think I'm talking to everyone on the platform. As participants on Medical Mondays with Dr. Ho, you feel that you're not right. Things are not just right. Ask for help in the mental health arena. For healthcare providers on the platform tonight, I'm begging that we'll be more empathetic and spend that extra time to actually feel our patients, to know where they hurt and how we can direct them to care if we cannot give it. It's very important. Thank you for that extra course you took to be able to better serve your patients, Dr. Udim. Thank you. So tonight is so charged. I can see that everybody is sitting and digesting this. So I don't see the hands up for questions, but Dr. Udim, kindly post your contact because I know people who want more than the conventional physical therapy may want to seek your professionalism. Another thing is you wrote a book. I found out about it. I think you should tell us about the book and how to get it. Dr. Popola, you have your hand raised. Kindly unmute and chime in again. You're still muted. You are muted.
Oh, sorry. I was looking for where to unmute. Trust me. Yeah, thank you so very much, Dr. Elisha,
Yes,
and
sir.
the overview given by, of course, Dr. Person. Sincerely speaking, it's a whole area of specialty, physical therapy, mental health, and it's based on the fact that any patient that has chronic conditions, even acute scary conditions, there are going to be a lot of reaction, mental components to it. And a lot of patients in this category end up getting stuck. So one of the things is as the patient improves in functional mobility and you relieve their pain and discomfort, the big thing physical therapists do is that we are so close to the patients, to our clients. Let me put it that way. Okay? Even if it's hurting so badly, you want to move that joint. Okay? Even if it's bleeding, it's after uh, extensive bones and all the other things, you want to move that limb, you want to move that joint. So you have to have that attitude of patience. That was why I said I will have failed some of your questions when you're asking how many minutes will I spend with a patient. Definitely, patients in this kind of conditions, you have to give it all, whatever it takes, knowing fully well that every single thing impacts the outcome of management. So this is not the point that we are going to start stretching it. Those things within particular mental health diagnostic codes, but certainly all across, because movement underlies the basics of activity and behavior, and that's the big connection. It works every time. When this was started in UCH back in the 80, 84, 85, they gave us a whole floor because there was just, and I can tell you that many people. So down the road, when it became a specialty here in America, I was really thrilled that finally we are getting the point right. Yeah.
Hey,
So
stop. It started in Nigeria, in Ibadan. Are
I,
you
I believe so. We are versatile.
before we got it in the US?
I believe so. I can tell you the
Oh,
truth. What happened there, this is physical therapy.
okay.
It
Yeah,
started in England, and
that's
it was,
interesting.
yeah, it was Nigerian, Australia, Canada were the first to go into baccalaureate degrees. It was, what do you call it? It was just a technical line, okay, even in Britain. Okay, we started doing BSc, MSc in physical therapy before most people in the world. Now the Nigerian situation is this: we don't have occupational therapy, we don't have speech therapy, we don't have chiropractors. Okay, we don't have optometrists. Okay, PT filled all that gap, so we're a little bit more versatile. We started doing 5, 6 years program. Currently, a 6 years program in Nigeria, even while we are still doing 3 years in America, 3, 4 years in America. And PT is trained in the College of Medicine alongside other specialties. When I got in there and I said, I was going to teach in a school, and I said, no, where is the world journey? Where is this and that? And they said, no, it's you train them outside, and they use most of the time learning under clinicians. And I said, no, that's not what we do in Nigeria. But over here too, PT, but that is the bottom line. Because we don't have all those subspecialties that are not well represented in Nigeria, we fill that gap for everybody. And that is why the
Wow.
Nigerian trained physical therapists, Dr. Udim, I'm counting you as one of us, okay? Okay? We are a little bit deeper and wider when it
Yeah.
comes to contact with patients.
Fantastic. Thank you
Yeah.
so much. So that's why you have that wide breadth of knowledge too, because you've done it all before coming to the US.
Yep.
Yeah.
Yep. 16
Yeah.
years.
Solid foundation. Yeah.
Yeah.
Fantastic.
24 years
Thank you so
practicing
much.
in UCH and LUT
How many?
alone.
24?
24 years practicing in UCH and LUT. 16 years as an academician professor. Okay. Then so many private practice all over Lagos. PP.
Wow. Wow.
That was
Thank you.
the main. You know, what is PP, ma'am? Tell them.
Dr. Woodin?
No,
What is which one?
no. It's the question. I mean, PP is
PP?
private
Private
practice.
practice?
Uh-huh.
Oh.
That is when you do all the home care and all that. And this is also an addition, please, if I may say. Patients pay right out of their pocket in Nigeria. So anytime you are meeting a patient, either in the hospital or out of the hospital, is looking into your face, is dipping his hand into the pocket, is stopping his children from going to school, is selling his cars just to pay you. That is why we're a little bit more involved and make sure the patient regains ambulation in particular as early as possible.
Thank you so much. Thank you for
Yeah.
that contribution. Appreciate you. Thank you. And Dr. Woodin, please tell us
Yes.
about that book.
Yes, I'm going to share my screen again. Thank you so
Not
much
inside
for
with the books. Thank you.
So thank you for listening, everyone. This QR code will take you to my Substack. I'm a writer and I write a lot about my journey as a physical therapist, and I share experiences from other clinicians and healers and health and wellness things. So if you like writing, if you like to read other writers, you can follow me here. And then I'll leave this for like 10 more seconds, and then I'm going to move to the next one. But my book is Liberation Through Practice, Voices of Black and Indigenous Healers. It is being printed and published in Ibadan right now as we speak. So thank you, Dr. Popola, for mentioning that. You are one of few people who know about the true origins of physical therapy. And when I try to tell my colleagues, they just look at me and wag their tails. I said, okay, you don't have to believe me, that's fine. But when my book comes out, so my book, like I said, was my dissertation when I received my EDD. I turned it into a memoir. In addition to a research book, you'll also see, pages of quotations and references at the end, as well as I interviewed experiences of other physical therapists in the field and how they navigated implicit bias in the workforce, specifically around the pandemic and how that affected their satisfaction in the field. I have my poetry, I have some history and information about, like I said, the origin of physical therapy and kind of what I'm researching now or what my research will be in the future. So I will be printing and bringing that back. So if anyone is interested, you can email me. My email is attached to the link tree that I dropped in the Zoom. And the textbook, if you would like to purchase it, you can purchase it on Cash App, you can purchase it on Venmo, and it is all tax deductible through my nonprofit, the Wupanima Institute. And if you'd like to follow me on Instagram and stay tapped in or in touch with my travels, and I'm actually going to get the books in Ibadan in a couple of weeks, so I'm excited about that. And I'm looking forward to finding these other physical therapists when I go too. So thank you. And that is it. That's all I have. Thank you.
Thank you. So if you can put that in the chat box, that'll be great. I was able to get it. I was able to get the QR code but on my phone.
Yes. See if I can copy the link here.
I'm not sure if I can buy the book from that, but I was able to copy it. So if you can put the Instagram, this page in the chat box, that'll be great.
Sounds good. You're
Okay.
welcome.
Well, you can pull this down. Oh, you put it finish first, please, because that it'll be easier for you to do that way. Did you put it all in?
Yes.
Fantastic. See, you guys, techie guru. Yeah, Dr. Kukwala, you have your hand raised again. Kindly unmute. Are you looking for the mute or mute
A
button?
quick at this time. Honestly speaking, Dr. Udim, I do congratulate you. Dr. at Koja knows that whenever I see a writer, I'm always so excited because you have a little bit more brain than we ordinary people. Okay? Even the title of your book, honestly speaking, is enticing, if not provocative enough. I want to see what's in that book. But can I take your permission to Dr. Okwesome and this forum to send it to our colleagues? Because already we have two sources of Nigerian books. One is through, this is IMPT, International of Nigerian Physical Therapists. And there are so many of them who are also excellent writers. So this one particularly, I'm sure is going to talk about some stories that have some social bandwidth, okay, that will puzzle some of us and make us respect you the more. So I'm going to buy the copies anyway. I would have said I would have bought a couple more copies and put it in libraries, but certainly you've done very well to be able to write a book.
Yeah.
And to write a book about yourself, growing and impacting through your practice. That's spectacular. Congratulations, ma'am.
Thank you. And please, Dr. Kukwala, please share. I'm not even asking a permission. I'm saying, yes, you can share the book with the colleagues on those platforms.
Yep, they would love to.
Do you want the QR code sent to you? I don't know if it's the QR code. I think, which is the best way to order the book? Because I didn't see, it says to subscribe in the QR code.
The QR code is for if you want to see my poetry and my writing. And then in the link, yep. So I will also put my email because if you want the book delivered to you, then I will deliver it personally. But when I bring them back, I'll be having book tours, going to like Busboys and Poets and local libraries. And that's where I will largely disseminate my books. But if you want it earlier or if you want me to mail it to you, that's also an option. I would just need address. So I will put in my email in the chat.
Fantastic.
my institute. So there you
Fantastic.
go.
Dr. Kwasomi, you haven't commented on the AirPod and these eyeglasses on our presenter.
I'm going to leave you to do that commenting.
No.
It's amazing. It's
Dr. Udim,
beautiful.
these are also unique
Yes,
with a big
beautiful.
Q.
Yes. Unique. I love it.
Thank you.
And Dr. Kukola, on a more serious note, thank you for bringing that up because I've been looking at that this is unique. Yeah, nice. So, if there are no more questions, I'm going to ask you
I have a question.
Go ahead.
Well, maybe a couple. Yeah, a wonderful presentation, Dr. Udim. If you're doing a book tour, I would like to recommend you talk to a lady in San Francisco who's a Faith Adiele is her name. She's also a professor, but she a lot of she also is the I think president of African Book Club in San Francisco, which is and a lot of Africans, not just Nigerian and African American for that matter. When they're on a book tour, if you want to come to San Francisco, I could do the introduction. And she heads an organization in San Francisco that they give a good publicity to your book. So I don't know where you live, but if you're interested in talking to her and coming to San Francisco to discuss your book, I think she'll be a good contact for you to talk to. Either way. That's
Thank you so much.
Mhm.
Yeah. If you email me the information to that email, I will reach out.
I will.
So I appreciate that.
Sir, is it okay if I share your contact with her? He has muted. Well, I'll share his contact.
Thank you.
I'll make sure you connect. Yeah, thank you so much, sir. I appreciate you. So, if you give us your parting words, what we need to take home, that would be fantastic to round up.
So my parting words always is be yourself. I think when I was a brand new spanking physical therapist, I tried to be like my mentors and emulate, and none of it ever quite fit. And so the last 10 years, that's one thing, whether you're a physical therapist, a medical doctor, a librarian, an actor, actress, that shines through more than anything. And I think maybe that's Dr. Kahindi. I don't know if I'm saying her name correctly,
Dr.
but she was
Kahindi,
saying
yeah.
earlier, like
Elisha.
some people are just gifted in the skill of empathy, or in the skill of being able to maintain who they are at all times. And some people are not. And that's one thing that I would say that's my takeaway. Because if you are being your most and your truest self, all of the time, I don't think you can't fail. Because you're put on here for a reason, and everyone needs to see and feel your gift. And once again, Dr. O, like, this is your gift, and I'm grateful for walking up to you and giving you my business card the first day I met you. I don't know why, but I'm grateful that I did. And because over time I have seen my confidence from the first time I was on here to now. And so I'm grateful. So that's my takeaway, wherever you are. And take care of yourself. Drink your water. That's it.
Thank you so much. This has been, very educational, fabulous. Thank you.
Thank you for having me.
Thank you. And till we see again next week, please stay safe. I'm glad, Dr. Udim talked about COVID. COVID is still very real. Let us be wise and keep safe. Thank you all.